Hi guys, this is Dr. Leslie Blevins from Enilda Clinic at enildaclinic.com. Today I'm going to talk about language. This is something that seems to be a bit confusing whenever I bring it up with my families here at my clinic. It is a part of IQ whenever we measure it, and that component is just a child's ability to reason with words. And then there's also the ability to utilize language expressively and to understand it receptively in our day-to-day life so that we can effectively meet our adaptive needs. And so sometimes whenever I'm talking to a family and I'm saying something like, I think that we might want to evaluate for a language disorder, I'll have the parent say back to me, oh gosh, they just have such a great vocabulary. And so they might have a little bit of disbelief. And sometimes, maybe the kid doesn't have a language disorder. That's cool too. But there's so many facets to it. And so I wanted to just kind of go through a few different facets of language today. Definitely not everything, but a few facets that I look at whenever I'm working with a kid and I'm starting to see a potential to have concern and maybe do some extra testing. So first with our young kids, our preschoolers up to maybe 7 years old, oftentimes if there is a good bit of misbehavior going on, non-compliance, argumentativeness, a general poor mood, then I'm always going to be assessing for language. The key intervention for young children is to increase their language, because as you increase language, poor behavior goes down. And so that's just a number one right there. And then for my older kids, if I'm hearing that they're non-compliant, which for older children, oftentimes parents are phrasing it as they're stubborn, they just don't want to, they have an attitude. So maybe the phrasing is a little bit more about personality once the kid gets 8, 9, or 10 and older into those teenage years. But it's always about non-compliance, right? Like the child isn't doing what you need them to do. Then I'm also considering language at that point. Sometimes though with the older kids, I'm still going to look at that overall expressive and receptive language. For the older kids, I think for many of them, the expressive language deficits are caught much earlier. Not all the time, but usually. But oftentimes it's receptive language deficits that might be more subtle, especially for bright kids, that might still be impairing once a kid gets a little bit older. And then there's also social communication deficits that could be impairing. That's really a big thing that I wanted to chat about today on this video. I think most of you probably know what expressive and receptive communication are. So just expressive is being able to say what you need to say to get your needs met. Receptive is being able to understand what someone says to you. But social communication is kind of the purpose of communicating at all. It's, if you take, for instance, what I'm doing right now, I'm using gestures, I'm using intonation in my speech, I have affect, I am trying to convey a lot of nonverbals along with the actual words I'm speaking in order to give the language I'm using even more meaning. Many times I kind of slow down a little bit, or I might emphasize words. Sometimes I speed up a little bit. There's all kinds of little nuances into what I'm doing. Sometimes I use phrases, or there's just like little pieces of information clustered together in my language that helps convey the intent of what I want to say so much more effectively. And for most people, the vast majority of people, they understand what I'm saying. But for a child or a teenager with a social communication deficit, they won't have that automaticity with understanding what's being said. And so you can think about an idiom like the writings on the wall. They might have to think that through. They might literally interpret that and actually imagine writing being on the wall, or they might just have difficulty actually understanding what the intention of that phrase is, and they might be able to get close to it, but not exactly. And so if you think about how many times we use that type of figurative language in our speech, and it's almost all the time, then children that do have those types of social communication deficits can really start to get pretty far off the mark with their interpretations. And then if you add on understanding the nonverbal cues, or even just piecing together little things like time indicators, like this happened next, and last this happened, but first this happened. So just putting things in sequence. If they're not able to give a good sequence with what they're saying, then the listener would actually have a good bit of difficulty understanding the logic of what that child is saying. And so you as a parent might have learned at this point, if your child had this type of language difficulty, that it's just going to be super difficult to get a story out of your kid because it's going to be hard to get the logic of the story. You might be able to get the concrete details, but to understand like that sequential logic will be hard, or even the cause and effect portions of it will be hard. So understanding, Sue did this because Billy did this, those portions of the language will oftentimes be left out. And whenever your child's relaying to you information or even trying to explain their own behavior, it's going to be pretty difficult for them to do it. Now, there are developmental milestones with understanding cause and effect, and many children are over time developing an understanding of cause and effect. So I'm not saying if your kid doesn't get cause and effect, they have a language delay. I'm not saying that at all. I'm just saying that, especially for your older kids, maybe adolescents, that they should absolutely be able to relate some cause and effect for social situations. So I wanted to just kind of throw out there that there is this third piece of communication, which is social language, that starts to become much more relevant in middle school and high school, because that's whenever we're starting to do the more advanced reading comprehension. We are reading to learn, and your teachers in those grades are expecting the students to pick up on the subtleties in their instructions and even in their mood. Whenever they're giving instruction at the front of the class, they're really starting to train the kids on how to take instruction from a boss, right? Like how to coordinate with a group. You can think about how children become more independent with their social skills and with their friendships in middle school and high school. Kids who have social language impairments, oftentimes this is when those difficulties start to become more apparent, because that's when the real gaps start to show up. So I just wanted to point those out. I hope you enjoyed this video. And I'll see you next time. Okay, thanks, bye.